be talking about some depression and anxiety, some of the integrative approaches as well as the traditional approaches. My colleague Nadine Miles is our physician assistant here. She joined us in 2017. She was in the ER for 7 years after attending PCOM, Philadelphia College of Osteopathic Medicine's PA program. Definitely a big topic. You know, this is very prevalent, and you know, without further ado, here's Nadine Miles.
Good evening, everybody. Hi, Nadine. How we doing? So today we actually have to start the evening with a joke. Because when I told my children that I was going to be giving this lecture, they started telling me all these jokes to tell you guys. So I promised one of my daughters that I would give a joke. Her joke. So you guys have to participate with me. It goes like this. Knock, knock.
Who's there?
Interrupting cow.
Interrupting cow.
Moo! So of course when my son heard that I was telling my daughter's joke, he said that I had to tell his joke also. So here it goes. This one's actually pretty good. So why do seagulls not fly over the bay?
Why?
Because then they would be bagels.
Right?
So, okay, thank you all for coming tonight. This is a really important topic. It's very near and dear to my heart, and it's a very kind of a big problem, and there's more than one way to address it. We're going to talk all about that today. Excuse me. According to the World Health Organization, depression is currently the 4th leading cause of global burden of disease. And basically, 20% of the world's population reports depression at some point in their life, and it affects 18 million adults. It's the leading cause of disability in people ages 15 to 44, and it is the primary reason why someone dies of suicide every 13 minutes. Total economic burden of major depressive disorder is now estimated to be $210.5 billion per year. And that's according to the Journal of Clinical Psychiatry. So it's a big deal. Similarly, anxiety disorder is one of the most common mental illnesses in the United States. Over 40 million adults are affected with this disorder, and it's estimated to cost society over $42 billion a year. So here's a few things that we're going to be discussing this evening. We're going to talk about the traditional definition and treatment of depression and anxiety. And we're going to discuss some of the origin of mood disturbances. So we're going to address some of the more integrative and functional potential etiologies of something like a depression or an anxiety. Talk about some testing modalities, and we're going to discuss some of the supplements and interventions as well. So depression is the result of a variety of factors, including biological, psychological, environmental factors. These factors end up disrupting our nerve signaling pathways in the brain. And what happens when that happens is you start to have feelings of sadness, lethargy, fatigue, lack of interest, and lack of appetite. So according to the DSM-5, the diagnostic criteria for a major depression disorder manifests with 5 or more of the following symptoms. And these symptoms have to be present most of the day, for nearly every day, for a minimum of 2 weeks. So one of the other criteria is that of all the criteria listed, you have to have at least one symptom that is either depressed mood or loss of interest or pleasure in most things. So some of the other symptoms are insomnia or hypersomnia, changes to your appetite or weight gain, psychomotor retardation or agitation, low energy, poor concentration, thoughts of worthlessness or guilt, and recurrent thoughts about death or suicide. Some of the traditional therapies include SSRIs, which are selective serotonin reuptake inhibitors, SNRIs, selective norepinephrine reuptake inhibitors, tricyclic antidepressants, lithium, electroconvulsive therapy, deep brain stimulation, brain light therapy, and exercise. And music therapy. So for generalized anxiety disorder, the DSM criteria is characterized by excessive and persistent worrying that is hard to control. and it causes significant distress or impairment, and it occurs on more days than not for at least 6 months. Other features include psychological symptoms of anxiety such as apprehensiveness, irritability, and then increased fatigue and muscular tension. So some of the ways that we treat anxiety disorders traditionally is through counseling. There's a wide variety of techniques, different types of theories behind counseling. One of them is CBT, known as cognitive behavioral therapy. This basically highlights the fact that your perceptions of the world, or your negative thoughts, basically, the way you perceive the world, can influence the way that you feel about the world, and therefore, or the world around you rather, and that can therefore influence your behavior. So kind of making an alteration to that cognitive distortion can make a change in the mood. Psychotherapy is the type of therapy that basically does an in-depth view of a lot of childhood experiences and how that relates to some of the ways that one is behaving. PE is prolonged exposure therapy. That's something that we see a lot in treatment of phobias or fears, and it's basically like a systematically increasing stimulus of the thing that you're having a phobia of. So if you're afraid of spiders, for an example, you go into a room and there's a spider there, and then you walk out. And the next time you kind of walk a little bit closer, and then you walk out. So it's just a step-by-step desensitization. DBT, dialectical behavioral therapy. That's something that helps patients to basically manage their emotions. So that's something we're going to see in a patient with oppositional defiance disorder, or like a anger management type picture. ACT is acceptance and commitment therapy. This is something that encourages patients to utilize positive behaviors in the face of negative circumstances or negative thoughts. Oh, I apologize. So the other thing that we do for treatment for generalized anxiety disorder is medications. Primarily we use antidepressant medications. This is usually the way we kind of start with anxiety treatment. For the purpose of antidepressants are more long-acting, whereas something like a benzodiazepine is more of like a short-acting or situational anxiety relief, and it can also be addicting. Typically we use buspirone as the antidepressant, which is Wellbutrin, as well as beta blockers. So now we're going to talk a little bit about more functional approach, a more integrative approach to addressing the causes of depression. So traditionally, in traditional medicine, depression is just a chemical imbalance in the brain, and that's true, it is. But what's causing that chemical imbalance? What can we do to make sure that that chemical reaction that's going on in the brain is being optimized? Okay, and one of the ways we can do that is by assessing oxidative stress. So we're going to talk about this a little bit in depth later. Oxidative stress basically means DNA damage inside your body. When you have oxidative stress, it's equivalent to an apple turning brown or a wrench rusting. So nutritional deficiency is something we're also going to spend some time on tonight. A lot of nutritional deficiencies, nutrient deficiencies, micronutrient deficiencies are associated with lack of your ability to actually create brain chemicals such as neurotransmitters. Hormonal imbalances can certainly be the contributing factor to your mood disturbance or your anxiety. We're going to look into things like sex hormone, thyroid hormone imbalances, as well as adrenals. And then neurotransmitter imbalances, again, we're looking to see how we can optimize neurotransmitters. We're not trying to just affect them with pharmacology, right? We're trying to see if we can create more of them, make sure that they're functioning optimally. Genetics, this is another origin of mood disturbances. It's definitely a hot topic right now. Basically, there are certain mutations genetically that you can have that puts you at a predetermined, like increasing your chance to have some type of depressive or mood disorder. One of them that is kind of hot in the news right now is MTHFR, which is basically a gene that promotes, it's an inability to process folate, and it puts you at risk for cardiovascular disease, autism, blood clots. If you're a female, puts you at risk for miscarriages, also symptoms of depression or anxiety, and certain types of cancers. Also, the COMT gene metabolizes estrogen and dopamine, so if you don't have enough of that, then that leads to potential poor utilization of those two, the hormone and neurotransmitter, as well as MAO deficiency. If you have a deficiency of that, or if it's an underactive gene, you may have inability to basically break down dopamine or norepinephrine or serotonin. So, situational. So, depression or anxiety or any type of mood disturbance can certainly be situational. If you have a death in the family, or if there is some type of financial burden, some type of illness that you've just been diagnosed with, certainly a change in mood is appropriate. Environmental. So this is kind of an interesting topic. We're seeing a lot of prevalence in mood disturbances just based on our environment. So areas where there's higher pollen counts, we're seeing higher incidence of depression. We're also seeing higher incidence of depression in places where there's a high pollution count, like a high smog area. So that's kind of, I think, very interesting. But some of the ways that we evaluate for chemical exposure and things of that nature is by doing a urine toxicity screen. So when we do that, we can assess whether or not there are molds or solvents or pesticides or herbicides in your body that you're not able to detoxify. And that can certainly contribute to not being able to feel well, because that chemical burden is impeding some of your body's functionality, I should say. All right, and the very final thing I think is kind of interesting. It's also really just being developed as a theory, but there is a theory that depression, symptoms of depression specifically, can be the result of a viral infection or a bacterial infection, or even a parasitic or fungal infection. And the idea is that a fungus or a virus can basically come into our bodies and unravel their DNA and manage to splice snips of their DNA into our DNA and then override our neurological symptom, or override our neurological makeup rather. So it's interesting, the things that we're studying about depression, and I think that there's still a long way to go. So oxidative stress is one of the first topics we're going to go over. Basically just means DNA damage, okay? Oxidative stress may be the underlying factor for the pathophysiology of a brain disorder, such as bipolar disorder, major depressive disorder, and schizophrenia. 20% of the total oxygen consumed by our brain, 20% of total oxygen that we consume is consumed by the brain. And so that means that the brain needs that oxygen to be optimized, right? So if you're having oxidative stress, you're going to impede that ability of oxygen to kind of get into the brain and do its thing. Glial cells, which are the cells that kind of surround and insulate and protect your nerve cells, neurons, are cells that actually require more oxygen and more glucose consumption in order to produce energy. And these cells are specifically susceptible to oxidative stress. So when you have a lot of oxidative stress in the brain has only 10% of the liver's ability to detoxify. So it becomes kind of like you're in a trap where you can't get rid of this oxidative stress because your brain doesn't have the mechanism to do so. So really want to try and make an effort to alleviate that oxidative stress and then kind of prevent it from happening in the future. And the way we assess oxidative stress is basically with a urine oxidative stress test. It's 10 milligrams of urine. It's the first urine of the day. You send it off, and we get something similar like this. We review it, and we can see the level of DNA damage that you have in order for us to know what we can do to impact it. So when you have a high level of oxidative stress, you basically want to look for an antioxidant. And NRF2 is a really awesome pathway that we can use in order to get rid of some of this oxidative stress. So what it is NRF2 is a powerful protein. It lays dormant in your body. It doesn't do anything at all until it's released by NRF2 activator. And the things that release that can turn on NRF2 activator are high levels of free radicals in your body, sulforaphane, turmeric, green tea extract, pterostilbene, which is an antioxidant that's found in berries, as well as coffee. So once you get this NRF2 activator going, it kind of splices open your DNA and it releases an antioxidant known as antioxidant response element. That's known as ARE. So antioxidant response element is a master regulator of all of your antioxidants that you have in your system. So once that is released, then you can start to process that oxidative stress. So here's a study showing that NRF2, when it was activated by sulforaphane, which is a broccoli sprout extract, showed improvement in depression-like behavior in mice. So that's one of the supplements that we're going to talk about today. It's called NRF2 Activator. Basically, it has turmeric and green tea extract and pterostilbene, as well as sulforaphane and a little bit of black pepper. And if you take 1 or 2 of these capsules per day, you can improve that oxidative stress. So it's pretty cool. Another antioxidant that is one of my favorites is glutathione. This is a major free radical scavenger in the brain. It's basically, you can take it by mouth, you can take it through an IV, you can even inhale it, you can nebulize it, and it's a great antioxidant. We've found that in patients with bipolar disorder, there are levels of low levels in bipolar disorder, low levels of glutathione and increased oxidative stress, as well as the dysregulation of glutamate. So when patients in this category were using something called N-acetylcysteine, which is a precursor to glutathione, results showed that 85% of people achieved full remission of their depression symptoms and manic symptoms. So it's really interesting. The next antioxidant I want to talk about is resveratrol. I'm going to say this one's my second favorite because I really love glutathione. Resveratrol is an antioxidant that we see in red wine and chocolate. And this is a study basically that shows the use of resveratrol was actually shown to reverse depression and anxiety-like symptoms in patients with intestinal dysfunction. So this also highlights some of the gut-brain connection. The gut-brain axis is newly being studied, and it's being realized that actually we are what we really eat, right? So the gut-brain reaction, the gut-brain axis talk is basically all about your microbiotica. So microbiotica is your pre and probiotics that you have in your belly. It's just like your inner terrain. Imbalanced microbiotica is actually associated with a lot of metabolic disorders, so obesity, diabetes, and a lot of neurological disorders such as anxiety and major depression. So if you don't learn anything tonight, there's this one thing you have to learn, and it's that 90% of our serotonin, which is a brain chemical, our excitatory brain chemical, it's the brain chemical that makes us happy, right? Makes us feel tranquil. It's made in the gut. So we're going to say that a couple more times tonight. By the end of it, we're all going to say it together. Basically, the way we evaluate the bugs in your gut is in a stool sample. And so basically, it's the same idea. You go home with a kit, you put some stool in a box, you send it off, and we get something similar to this where we're able to assess how many good bacteria you have, what kind of bad bacteria you have, what kind of acceptable bacteria. Is there any yeast? Is there any really difficult to kill off, difficult yeast? We evaluate enzymes, inflammatory markers, and whether or not the inner lining of your gut indicates that there's a leaky gut. If you have a leaky gut, you have a leaky brain, so we have to address that. So we're going to talk a lot now about all of the nutritional and gut imbalances. There is a huge connection between food habits and mood disturbances. People who suffer from anxiety and depression frequently display similar patterns when it comes to eating. They all share in common poor appetites, skipping meals, and high sugar diets. And there is tons of research that indicates that nutritional factors are closely related to cognition, behavior, and emotions. So the foods that we eat get converted into neurotransmitters, right? Which if we have lots and lots of neurotransmitters, and those neurotransmitters or brain chemicals are working well, that can in turn alleviate some of your depression symptoms and your mood disorders. There's scientific evidence that's accumulating to actually support nutritional supplementation as an intervention for mood disturbance. So the things that you want to avoid are the things that you would expect. So caffeine, alcohol, processed foods, fried foods, processed meats like hot dogs and cold cuts, sweets, and you want to try and avoid skipping meals. Now, we're going to talk a little bit about carbohydrates, and I think I'm going to kind of annoy everybody because a lot of people, have trouble with, should I eat carbs, shouldn't I eat carbs? Everyone seems to feel like carbs are not good anymore, and I'm here to tell you that patients that have a very low carb diet have a higher prevalence of depression. Sorry, guys. So what that means is that if you're somebody who's not eating a lot of carbohydrates, there's a higher incidence of low mood, bad moods, things like that. And the reason is because when we eat a carb, that carb stimulates insulin, which opens up our cells and allows glucose to come into the cell. Glucose is sugar. We utilize sugar to make energy, okay? And when that happens, it also allows tryptophan, which is an amino acid, that gets converted into serotonin. So it allows tryptophan to come into the brain. Tryptophan comes into the cell, and it allows tryptophan to make serotonin. So studies show that if you're not eating a high carb diet, then you're not able to make that conversion to serotonin. You're having actually lower levels of serotonin in the brain. It's actually one of the reasons that everybody loves eating carbs, because it makes them feel so good, right?
Can I ask a question?
Sure.
What about type 1 diabetics?
So let me get into that. So I should have prefaced by saying diets are extremely specific from person to person. So what I'm saying here is like based strictly on depression, anxiety, and the findings that we have regarding just depression, anxiety. But some people can't have carbs, right? Some people prefer high-fat diets. So we tailor them one-on-one, one person to person. So it's something that you have to kind of work with your provider to kind of create a specific diet just for you. So regarding the carbs, so even though all those carbs make us feel really good, you want to try and find a carbohydrate that has a low glycemic index. And when you have a low glycemic index, that means that there's a high level of fiber when compared to sugar. And that's going to basically process for a longer period of time in your body. Things that include low glycemic index are like cherries, pears, apples, broccoli, Brussels sprouts, wild rice, brown rice, quinoa is another one. So you want to try and make your carb choices smartly. That might actually answer your question as well. All right, so moving right along to proteins. A protein is basically made up of amino acids. And the amino acids, each individual amino acid, they kind of get built together to form a protein. And the way we use the amino acids to make every single structure in our body. There are 20 essential amino acids. 12 of them we make naturally in our bodies, and we have to consume the other 8. So you want to try and find a high quality protein. You're going to find that in any type of animal protein, any type of a dairy product or an egg. Whereas if you're a plant eater, you're going to have to work a little bit harder to make sure that the plants that you're eating, a variety of plants, in order to get all 20 of those amino acids. So plant eaters tend to kind of include a lot of beans in their diet, a lot of peas and quinoa, because those particular plants they're only missing like 1 or 2 amino acids. So you're getting as close to 20 as you can. So remember we talked about tryptophan making serotonin. There's another amino acid called tyrosine, which makes dopamine. And actually studies show that if you don't have a lot of these 2 amino acids, you actually end up with low mood and high levels of aggression. So it's interesting. All right, next we talk about amino acid, or omega-3s rather. Omega-3s are associated with nerve health, and they're anti-inflammatory as well. Your omega-3 fatty acid index is basically a ratio of your omega-6 to omega-3. We actually measure that in our cholesterol screen, the Boston Heart. I want to say that the DHA and the EPA of the omegas have been found to produce antidepressant-like effects in humans. And they also impact nerve signaling. So studies show that patients that are low in polyunsaturated fatty acids, omega-3s, have mood disturbances. So in a healthy individual, 1 to 2 grams a day is probably enough. But if you're someone that has a mood disorder, 9 to 12 grams a day is probably going to be just fine. And that's a lot. So, it's best to try and find one very high quality, first of all. and then as high of a milligram that you can. So this is the study that we were just talking about. It's basically a study suggesting that diets low in omega-3s were associated with personality changes. So high levels of neuroticism, low levels of extroversion, low conscientiousness, and high levels of cognitive reactivity, so hopelessness and suicidality. So vitamin D. This is a really important hormone. Associations with low levels and depression have been well recorded, particularly in women. Vitamin D is implicated in over 400 gene functions. It's anti-inflammatory. It's flu protective when you have optimal levels. It's even been shown to be anti-cancerous. So this is a really important hormone for us to take, particularly in the winter months, and particularly because at higher than 37 degrees latitude, that's like north of Virginia, there's a higher prevalence of low levels of vitamin D. So especially in the winter, I mean, if you don't take vitamin D all year, which you totally you should definitely at least take it between October and February. Because what ends up happening is you're supposed to really get a good 15 minutes of solid sun in the summertime, and we're really not even doing that. And people are putting sunblock on, and that sunblock is even preventing the vitamin D from absorbing into the skin. So take vitamin D, please take vitamin D.
What levels do you recommend?
So in the winter I would do 10,000. Unless you know what your level is and you know you're optimal, then I would do 5,000. But for winter I would do 10,000. So vitamin C is an essential antioxidant. We're actually the only mammal that don't produce it. And vitamin C basically scavenges oxidative stress, so that's cool based on everything we've learned so far. And it helps to process your brain chemicals as well. So 1,000 milligrams a day is probably enough. All right, B vitamins. So all B vitamins are associated with nerve health and improving anxiety and depression type symptoms. Patients found with low levels of B vitamins have a higher prevalence of depression and anxiety. Vitamin B12 is actually, the use of vitamin B12 has actually been shown to delay onset of dementia as well. So 0.8 milligrams of folate per day and 0.4 milligrams of B12 per day have been shown to decrease depression symptoms. But honestly, just get a good B complex. Don't take them all separately because it's cheaper. So next one is called SAMe. This is a really awesome nutritional support that we can use. SAMe is basically the result of the amino acid methionine converting ATP into SAMe, which is S-adenosyl L-methionine. It's a molecule that's naturally formed in our bodies, and it helps to aid in the processing of neurotransmitters or brain chemicals. So it's actually one of the products that we have available today. It's an awesome, awesome supplement. And what it does is SAMe basically contributes to the synthesis, activation, and metabolism of neurotransmitters. Not only neurotransmitters, which are brain chemicals, but also proteins, nucleic acids, phospholipids, and hormones, and also some drugs. It also supports glutathione production. So if you take it, you're helping to kind of process out some of those neurotransmitters, and you're also helping to create some of that oxidative stress relief with that antioxidant glutathione. It also promotes liver health, joint comfort, and a healthy mood. If you're a person who's on a lot of medications, it can potentially help protect your liver from some of the side effects of that medication. So what it's really doing is it's just breaking down adrenaline. So it's breaking down epinephrine and norepinephrine and helping to process it out. And so if you're that person that's very anxious and kind of exhausted all the time, and you're always in fight or flight mode, and you're a very, uppity person, this is the supplement for you. This is a supplement for you. Little side note, it also helps to detoxify your liver and can help support if you have a fatty liver. So you can also utilize it for that. So this is an interesting study that utilized SAMe in patients that were taking tricyclic antidepressants, and they kind of did a side-by-side, and they found that SAMe was just as effective at providing diminished symptoms of depression as the tricyclic antidepressant. There was actually another study that showed that when patients were on SSRIs, selective serotonin reuptake inhibitors, even if the patient wasn't actually having symptomatic relief on the SSRI, when they added SAMe, the patient was having diminished symptoms. So it's pretty cool. It's a pretty cool supplement. All right, let's talk a little bit about amino acids. I think we could probably do a whole lecture on them, but we're not. We're just going to do one little slide. So patients suffering from mood disturbances frequently have been researched to display deficiencies in neurotransmitters. So we're actually not making enough of that chemical hormone to basically give us that happiness, calm, tranquil feeling. That's kind of why we're, you know. So tryptophan, we've already talked about, but we're going to do it again. Tryptophan is the amino acid that is the precursor to serotonin. And most drugs, as we've talked about the SSRIs, right, they, what they're trying to do is recycle the serotonin that you already have in your brain over and over and over. So there's like 5 little molecules of serotonin in your brain are just trying to be recycled. But when you take tryptophan on an empty stomach, you can actually convert tryptophan into serotonin because 90% of our serotonin is made in the So, all right. So, and we also know tryptophan, right, as our favorite Thanksgiving meal. Everybody's happy and sleepy and cozy after turkey because it releases high levels of tryptophan. You're converting it into, so you could have that every day. All right. So let's kind of talk a little bit about tyrosine. Tyrosine is the amino acid that makes dopamine. Okay. And tyrosine is also a precursor to thyroid hormone. So if you're someone who is not making enough tyrosine, not only are you having symptoms of depression, but you're also having a lower functioning thyroid. So really easy fix is to just take some of that amino acid, take some tyrosine, or eat a diet that has a lot of tyrosine in it, i.e. a healthy diet. Okay, methionine we've already talked about a little bit regarding SAMe, but it is an amino acid that gets converted into SAMe when combined with ATP, which basically stands for adenosine triphosphate, which is basically synonymous with energy for the cell. And so this is actually one of our supplements. It's called Zymabolics, and it contains 10 amino acids in it. Remember we said that 8 amino acids we have to consume because 12 we already make. So this actually contains 10 amino acids, so all 8 of the ones that you have to consume. And so it's a really great supplement. It's a little bit more comprehensive than a traditional, amino acid supplement that you would get somewhere else. Will really just have branched chain amino acids, which are leucine, isoleucine, and valine. And because most amino acid supplements are basically designed to be used after a workout, so muscle recovery is like the main purpose. But the reason I like this particular supplement is because it gives you all 10, right? So you're kind of, you can totally use it after muscle recovery, but after an exercise workout or something like that. But it's a great supplement. And so the way that we test to see whether or not you're deficient in any of these amino acids, vitamins, minerals, or antioxidants is with something called micronutrient testing. It's done by SpectraCell. It's a blood test. We basically send out the test. We get multiple page report that gives us, what you're deficient in, what we need to work on, what we need to supplement. And I think it's important to say that whenever we supplement somebody, right, we need to make sure that the supplements that we're giving you, you're absorbing. And that's when something like a probiotic becomes super important. So probiotics play a major role in the bidirectional communication between the gut and the brain. And remember, where's 90% of our serotonin made?
In the gut.
Cool. So this was a really interesting study. It was a 2016 meta-analysis and randomized control trial that showed probiotics associated with a significant reduction in depression symptoms. So this is like pretty awesome finding. And I just want to very quickly say that that's not to say that you guys can go, get off your meds and just take a probiotic. No, that's not what this study is implying. The implication here is that when you improve absorption of nutrients, the stomach's ability, the gut's ability to absorb nutrients in your body, you're going to have lower symptoms of depression. It's not to say that a probiotic is a replacement for an antipsychotic drug or, an antidepressant drug. All right, so we're going to talk a little bit about minerals. This is another one we could probably do an entire lecture on, but we're just going to do a few things. So calcium is a big deal. If you're on an SSRI long term, it can actually inhibit you from absorbing calcium. So if you are a person who's been on it for several years, a calcium supplement is probably a great idea for you. Chromium deficiency is associated with depression. Iodine, provided by a functioning thyroid, provides energy metabolism for brain cells. Iron, very important for oxygenation and the production of those brain chemicals. Lithium, it's a choice treatment for bipolar disorder and depression, as well as schizoaffective. Selenium improves mood and diminishes your anxieties as well. Magnesium, maybe one of my favorite minerals, excellent for anxiety. Magnesium is deficient in almost everybody here, myself included. We're supposed to get our magnesium from food, but our soils are being farmed so aggressively that the minerals are kind of being depleted right out of our soil. So need to supplement with magnesium. Excellent for anxiety, for nerve health, for muscle recovery, for heart health, cholesterol support, as well as gastrointestinal support. Studies show that if you take anywhere from 125 to 300 milligrams of magnesium with every meal, and at bedtime as well, this actually led to recovery of major depression symptoms in less than 7 days.
What kind of magnesium? Are there different types?
Thank you for reminding me. So I really like people to take chelated magnesium, so magnesium malate, glycinate, or taurate. If you do magnesium citrate or magnesium oxide in these doses, you're probably going to end up with some diarrhea. So chelated, just chelated is what you need to say. Give me the chelated magnesium. All right, zinc is the last mineral we're going to talk about. Zinc is an essential micronutrient. It has a diverse biological role in the growth of cells, scheduled cell death, that's known as apoptosis, metabolism of cells, as well as regulation of your endocrine and immune systems, as well as nerve function. And a diminished zinc level has actually been implicated in the pathophysiology of depression and anxiety. So this is a study regarding zinc carnosine. Zinc carnosine is actually something we also use for gut repair. And this study is suggesting that zinc stabilizes the gut mucosa and helps to prevent damage and absorb nutrients, promote the absorption of nutrients. So the pattern is, the name of the game is trying to heal that gut, trying to get your gut in good shape to absorb what you're putting into your body. All right, so we're going to switch gears a little bit and start talking about some hormone imbalances. Certainly, we can seek out mood disturbances and things like anxiety and things like depression if there are hormonal imbalances. So thyroid imbalance, you can talk for 3 lectures about thyroid imbalances. Actually, Dr. Meyer is going to be giving a talk on thyroid next month. And I think it's a really important topic because a lot of us are having thyroid imbalances. But generally speaking, when your thyroid is underfunctioning or hypothyroid, you're going to have symptoms of depression. You can have symptoms of anxiety when your thyroid is underfunctioning, but typically speaking, that is consistent with Hashimoto's, which is a type of hypothyroidism where you're producing antibodies to thyroid hormone. If you're hyperthyroid or you're overactive thyroid, you can have symptoms of anxiety. So if you come in with depression, anxiety, we're definitely going to check your thyroid. And it's generally done with a blood test. You can do a thyroid test with saliva, but it's a higher cost. So estrogen or progesterone imbalances can certainly contribute to some mood disturbances. Estrogen deficiency can definitely cause signs of depression. Progesterone deficiency can definitely cause symptoms of anxiety. And then progesterone dominance, so too much progesterone, can actually give you some mood swings. Testosterone deficiencies, you can definitely have a presentation of depression if you have testosterone deficiency. But typically speaking, mainly men. I haven't really seen women who come in and complaining of depression and the result was a testosterone deficiency. Okay, so time for my most favorite supplement. Have I already said I have a favorite supplement? This is it.
Is that what we're
I have a few favorite things. This is, did you guys taste this? There's some up here, so if you want to drink it while we're discussing it, this is a good time. So Relax Max is my favorite supplement. I learned about it in January, went to it when I actually went to the Zymogen conference, and it's just a fantastic, fantastic blend of ingredients for somebody who's hormonally imbalanced or someone who just has simple anxiety. I actually gave this to my husband one morning, and he texted me on the way to work and was like, Relax Max is so awesome. And I was like, I know. So it contains a blend of ingredients that supports the body's natural synthesis of brain chemicals. There's an inhibitory neurotransmitter in there, GABA. It helps to balance your hormones and also helps to promote healthy glucose metabolism. So if you are a female and you have polycystic ovarian syndrome, this is a great supplement for you as well. All right, so let's talk a little bit about, what do I want to talk about now? I'm going to talk about the adrenals. So the adrenals are a little hat that lives on top of the kidney, and it's the guy that gives you all of your stress hormone. It's the thing that helps you deal with stress. So, I mean, what do you think our adrenals look like these days?
Hell.
Exactly, good. So what ends up happening is you work those adrenals and you just keep going on, you keep doing what you're doing, and work continues to be work and life continues to be life, and you start feeling anxious and you start to feel tired, but you're wired, you can't sleep, you can't relax, you're in that fight or flight, you're hyper vigilant all the time. So then what ends up happening is they kind of crap out on you. They stop working. And when that happens, your adrenals are known as underactive or just not active at all. And that's when we start to see symptoms of depression, fatigue, dizziness, headache. There's blood sugar imbalances. There's like salt cravings when you have adrenal fatigue, as well as weight gain or weight loss. So this is something that we test with a saliva test. It's a kit you go home with. There's 4 cotton balls in it. You basically chew on the cotton ball 4 times a day, 8 a.m., 12 p.m., 4 p.m., and 10 p.m. And then the result comes in and it's like a schematic that looks like this. And, you know, the green is the reference ranges, and wherever you plot helps us to kind of understand whether or not there's underactive or overactive cortisol levels, and then when we can support those. We can support them at different times of day. So it's a really interesting test, and definitely something that we do on anyone that comes in with symptoms of depression. Dun, 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 dun. All right, so this is my second favorite. It would be my first favorite, but I already said that one was my first. So. They tied. So CBD is kind of awesome. Cannabinol is basically an extract from the hemp plant. It has significant amounts of research behind it. CBD provides inflammatory relief from inflammation, pain, anxiety, psychosis, nausea, seizure disorders. It helps to improve your mood, and it does not give you that high, lethargic, stoned feeling. So there's current research right now that's being funded by the U.S. government underscoring CBD's potential as treatment for a wide range of conditions: arthritis, diabetes, alcoholism, multiple sclerosis, Parkinson's disease, chronic pain, schizophrenia, depression, antibiotic-resistant infections, and epilepsy, as well as other neurological disorders. It's also having some anti-cancerous properties, so it's really, really cool. Research shows that it's been implicated in over 1,000 genes that are different. There are over 1,000 genes differentially upregulated by CBD. That's 10 times more than THC, which is the active compound in marijuana plant. So the reason I like this particular brand is, number one, it doesn't taste disgusting, which some CBDs really do. But the number 2 is that it has a liposomal delivery mechanism, so that means that there's actually a fat molecule that's attached to the CBD molecule, and that actually allows the CBD molecule to cross the blood-brain barrier and actually deposit the cargo of the CBD right intracellularly into the brain. It also helps to enhance lymphatic circulation of nutrients as well. So it's very cool. It's available today. It's 10% off. You gotta grab it because it's not super cheap, so take the 10% off. All right, so here's a study that aimed to investigate whether or not CBD could induce rapid and sustained antidepressant-like effects after a single dose. And so, they went through the whole experiment, and they actually found that it could fast and sustained, produce antidepressant-like effects. And they also found that the CBD impacted the genetic expression of the synapses, which is kind of cool. All right, here's another study indicating that there is strong evidence to support CBD as the treatment for generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive compulsive disorder, post-traumatic stress, and they're saying when it's administered acutely. So one thing I just want to say here is that this study is suggesting that there's got to be further study to investigate chronic use of CBD. All right, and then this study basically clearly suggests that CBD provides an anxiolytic effect, which basically means an anti-anxiety effect. So after everything we've discussed today, it's kind of time to talk about getting your mind right as well. So we can put you on an antidepressant and we can fix up all of your gut disturbances and fix up all your hormones. But it's super important for us as individuals to do the work that we need to do to get our negative thinking straight. And so I pulled the next couple of slides from the Anxiety and Depression Association of America. And it's basically just kind of giving us some advice on how to get your mind right. And so the first thing that it says is basically accept the things that you cannot control, right? Not everything is in our control, and we have to realize that, and we have to accept that. That's a huge, huge, huge thing for people that have anxiety, right? Then you just have to do your best, and then you have to let the rest of it happen. You can't be perfect, none of us are. You have to maintain a positive attitude, and very important to learn what your anxiety triggers are, okay? Next, we have to take care of our body. We did spend a lot of time talking about this. So limit your alcohol and your caffeine, eat a well-balanced diet, and get enough sleep. None of us do that, right? The American Sleep Association recommends 7 to 9 hours of sleep per night. Center of Disease Control for Exercise recommends 150 minutes of exercise, moderate exercise per week, or 75 minutes per week of vigorous exercise. So exercising is a great way not only to detoxify your body through sweating, but to help kind of process some of those anxious or depressed-like feelings. And then you got to take action, right? You actually have to do something when you're feeling anxious. You have to do something when you're feeling depressed. So this is saying take deep breaths, count slowly to 10, and that's good, that works. I like something called 4 square breathing, where you take a deep breath for a count of 4, you hold it for a count of 4, exhale for a count of 4, and then wait another 4 seconds for the next breath. Giving back to your community. Okay, this is really interesting concept. Research actually shows that altruistic behavior actually releases something called a helper's high. So you actually get a release of endorphins and you get a feeling of satisfaction when you do something nice for somebody else. It actually distracts you from your own problems, helps you to feel grateful for what you have, and actually improves physical health. So do something nice for somebody. Okay, so the other thing is doing some time out, right? Like just taking time for yourself. It's recommended to do yoga. Yoga actually reduces perceived stress, reduces your heart rate, reduces your blood pressure. There's actually a study done by the University of Utah that showed that people that did yoga actually had a reduced response to pain, to like a pain stimulus. And there was also lowered brain activity related to pain on MRI. So, but you know, if you get to a point where you feel like you can't get these negative thoughts out of your head and you're having a hard time, or you just need to talk to somebody, or you feel like you're continually thinking about death or about hurting somebody else, please call the Suicide Prevention Hotline. It's 24 hours a day. It is 7 days a week. It's 1-800-273-TALK. It's totally confidential. No one needs to know that you did that, but it can certainly be a lifesaver. So I'm going to leave you with this book. This is my favorite book. So we've talked about a few of my favorite things. This is my favorite book. I think I bought this book for like 15 or 16 people. Every time I like open up my Amazon, like Feeling Good just pops up as like the first thing on Amazon for me. So basically it's written by a gentleman by the name of David Burns. He studied under Aaron Beck. Dr. Aaron Beck is the founder of cognitive behavioral psychology, actually right here in the University of Pennsylvania. And the book basically discusses how your thoughts and your perceptions of the world around you can influence the way that you feel. And when you're feeling a certain way, that influences the way that you behave. So, and the book gives you like very kind of concrete, basic ways to manually kind of make charts about what I was feeling and what's a cognitive distortion and what's really true in reality. And it really helps you to realize like, wow, a lot of the way that I'm feeling is self-induced, right? So it's a great book. It's like $5 on Amazon. It's not a big investment. You know, there's a wide variety of interventions for mood disturbances, and there's a lot of trial and error. Depression and anxiety, it's more than just a medical diagnosis. It's a reflection of your physical and your mental well-being. And it's your body's attempt to basically deal with not only outside stressors, right, but inside stressors, and the internal imbalance that we have going on. So taking the time to find that balance between internal and external environment, both biological and psychological, both spiritual and environmental, that's what's going to lead to the best chance of success. So thank you for coming tonight. These are our references. And these are my people.
You have questions? Is that CBD, is that addictive? 'Cause that's
No.
like made from marijuana, right?
So it's not
doesn't
made from
have that
marijuana,
in it.
yeah. It's
Okay.
not made from marijuana, it's made from
From
the
the
hemp
hemp.
plant. So marijuana is a female plant, the hemp plant is a male plant.
Okay,
it
so
doesn't
you're
have-
not gonna get high.
You're not
Yeah.
gonna get high from it, it doesn't have any psychoactive component to it.
I'm allergic to it.
Oh, bummer.
10%.
What are the dosages with
For all of
just
these?
going off of that? I mean,
Yes, you can just go off of all of this, that's fine.
and what are your thoughts on, I have hypothyroidism and I do take medication.
Hypothyroid?
Yeah, so
Here next to me.
does that still impact your mood if you're taking medication?
I mean, not if you're well controlled. You know, if your thyroid medication is controlling your symptoms, then you know, if you're still having symptoms of depression, then you kind of look somewhere else to kind of see. Because you know, just because you have hypothyroid and you have depression doesn't mean that the hypothyroid is the only thing causing.
Right.
The idea is there's a whole slew of places that you can look to kind of find something that could be contributing to the depression, right?
Yeah.
So, all right, thank you everybody for coming. I appreciate it.
Thank you.